The urine examination is perhaps the simplest and the most economical of all investigations in clinical medicine, but sadly, it's also underrated. Probably because at times it is difficult to interpret, and secondly because of the nature of it, it's not given as much importance as a blood test uh, does. I'm going to record a series of videos in this regard because I think that if we can interpret a urine test properly, it gives us valuable information with regards to virtually all of the systems of the body, which include the cardiovascular, the respiratory, the hematological, the renal system. And not only that, you can also pick up if somebody's got underlying vasculitis or not. And so therefore it's a must that a physician who is dealing with patients of all kinds must request a urine test wherever it is necessary. So, the standard urine report will consist of two portions. One is the macroscopic examination, and the other one is the microscopic examination. The macroscopic examination has different variables in it: appearance, turbidity, pH, specific gravity. All of them are important. These are the ones which are usually ignored, but nevertheless they are important. Glucose, protein, blood, nitrite, looking for infections. And the microscopic examination, it more or less confirms what you've seen macroscopically. There are six variables in the microscopic side: pus cells, RBCs, epithelial cells, casts, crystals, and bacteria. All of them are important, and they give us valuable information, even diagnostic information. First, we'll talk about. So, macroscopically, we've got appearance, turbidity, pH, and specific gravity. They're more or less present in virtually all urine examination reports. The appearance of urine means the color of urine when it went to the laboratory. Remember, there are four types of urinary colors which can be deemed as normal colors. But if the appearance is red, then it can mean that there is hematuria. But of all the four colors which are important, uh, the commonest are the middle two, and the first and the last one they're not very common. One of them is what we call as urine like water. In other words, the urine is colorless. The second one is lime colored. The third one is easy to remember, mango colored urine. And the last one is going to be iced tea colored urine. So these are the four normal urinary urine colors. Water and iced tea means that these are on the extreme ends of the normal variation. If the urine is colorless, it means that it is probably too much diluted. The person is drinking too much water, or the fact that there is a renal problem and the urine isn't concentrating enough. People who have got a colorless urine often complain of weakness, fatigue, and pain in the legs. So therefore, it's important when you get the urine color whether it's colorless or not. The usual color is lime colored or a mango colored urine, and the iced tea means that this is actually on the other side of the graph. So this person is probably heading towards dehydration. There are certain abnormal colors, like we can get blood, so we can get red colored urine, we can get purple colored urine, we can get green colored urine, and sometimes we can get really, really dark colored urine, also called as the Coca-Cola colored urine. We know that Coca-Cola colored urine often means that this is because of hematuria or there is breakdown of muscles, myoglobinuria, and so therefore these are abnormal colors of the urine. Turbidity means that whether the urine sample look clear or not. If it's turbid, it often means that there are solutes in it, there are crystals, or there can be pus cells. So turbidity more or less goes along with the appearance of urine. A turbid urine can denote that there is pus in the urine. The normal pH of the urine is acidic, so about 4.45 is the normal pH of the urine. A pH of the urine less than 4.45 means that the urine is acidic. A pH of urine of greater than 5.5 means that urine is alkaline. So the normal range is 4.4 to 4 to 5.5. An alkaline urine means that there could be possibility of infection because the bacteria cannot thrive in an acidic environment. So they want to change the pH of the urine. They want to make it more favorable to them. So they will change the pH of urine to make it alkaline. So if you've got a pH of urine which is more on the alkaline side, either the person is taking an alkalinizing agent like they're taking antacids, or there is a propensity for bacterial infection, and so therefore this person probably needs some kind of treatment if it confirms that there is infection or not. Specific gravity, the normal urinary specific gravity ranges between 1.015 to 1.020. This is the normal one. A specific gravity of urine of less than 1.015, that to 1.010, means that this is as clear as water. And so therefore this can go with either the person is drinking too much water or there is chronic renal failure, which has a pH of, a specific gravity of 1.010. A specific gravity of 1.020 means that the person actually has probably got like a turbid urine, and so therefore this would once again go with excessive amounts of solute in the urine. Thank you.